Hello, everyone. My name is Kelsey Dorsett Wilson, and I am presenting my closing capstone on Through Her Eyes Behind the Scenes of the Maternal Health documentary. This documentary was a project that was born out of my desire to contribute to my local community that's near my University of North Carolina A&T and to aid in positive maternal outcomes in Guilford County. The statement of need includes three major areas. First is Black women are 4 times more likely to die from pregnancy-related causes than white women. The statistic is one that is very well known in the maternal health crisis, but I really wanted to channel perspectives of women in my community that further encapsulate what this crisis looks like on a day-to-day basis. So while Black women are the ones who are most boldly impacted by maternal mortality, they're rarely welcomed into the spaces that strategize attainable solutions. Black women's voices are not centered in this movement, and that's a key perspective that's missing to create actionable solutions. So overall, I was drawn to create a project that invites and celebrates Black women's voices, experiences, and expertise to bring awareness to this issue. The three key objectives for my presentation are to highlight statistics about maternal and infant mortality in Guilford County, to share perspectives from patients, providers, researchers, and advocates, and to emphasize the importance of community and grassroots advocacy in promoting positive maternal outcomes. The summary of my project is the film synopsis, and I'll just annotate here. But essentially, Through Her Eyes centers the stories of Black mothers to provide elusive perspective on maternal health crisis. It highlights the rates that are specific to Guilford County, which is known to have some of the highest maternal and infant mortality rates in the country. Using public and private data sources, as well as reproductive justice experts, the documentary paints this really full picture of the impact of maternal health within the Black community. The ultimate goal is to educate and empower audiences to highlight how health providers, communities, and patients can be advocates for themselves to address high rates of maternal mortality. There are some key themes that I've highlighted within the documentary. The first is social determinants of health, which are key factors that are not related to your medical condition that impact your health. So these can include food access, housing, transportation, and your neighborhood. The next is medical care. We place a really large emphasis on what is the impact of care within primary OBG services, as well as highlighting some of the atypical providers, such as doulas and midwives, excuse me. Health concerns is the next category, and this includes what things make Black women more high risk. So this can include why are they more high risk for gestational diabetes, and why are they at risk for postpartum depression. Postpartum is the next category, which is a phase of pregnancy that's often overlooked, but it's incredibly impactful, especially for Black women. A lot of maternal mortality and morbidity occurs in this stage, so we really wanted to make sure that we emphasize this within the film. And the last one is family and community. As I said previously, I really wanted to highlight what the impact of community is in this space, but it also emphasized the importance of families, which includes fathers and your other children who create your entire village that really create memorable and formable experiences throughout pregnancy. I also here included the character arc. So we focused on three main character arcs when recruiting for the film. First is our moms. They are the center of the stories. I chose intentionally Black women in the community who have had adverse perinatal experiences. And I was really lucky to find people who represented all of the themes that are within the film, multiple of them represented within each person. And in this film, we have included 5 mothers. Next is doula and health workers. And this was a really great experience for me because it exposed me and the audience to how expansive the role of doula and midwives are and how access to these types of providers really plays an impact on perinatal outcomes. And so these are culturally competent health providers who are really dedicated to contributing positively to maternal outcomes. Last are advocates. And funnily enough, advocates are within doula, health workers, and moms. These are individuals who are really committed to advocating for women in this space. who use their voices on a local, federal, state levels to advocate for policy, but who also work within the community on a grassroots level to create initiatives that positively impact their moms. So really wanted to take a moment to highlight the community partners who were vital in the production of this film. The first is Every Baby Guilford. And I was connected to Every Baby Guilford through my partner through the YWCA, and they work closely together. Both of these organizations play a key roles in ensuring that Black women in our community have the resources they need to promote healthy pregnancies. Some of their programs at the YWCA include a collaboration with North Carolina A&T, my previous university, for a lactation consulting program. So helping mothers who have never had any experience or maybe don't have family used to breastfeeding navigate that process. Every Baby Guilford works with the state health department. And so they have a lot of funding to help support our moms. They run events in the community, the most recent being a Black Maternal Health Day, providing expansive resources to moms and their families. So these are really great organizations, and I wanted to be sure to spotlight all the great work they're doing in the community. If you'd like to watch the film, there's a link included on my fellow profile, which can be found at rfkhumanrights.org. I've included the first 5 minutes, but we look forward to having the entire film available on a streaming platform in the future. Thank you for coming, and I hope you enjoy.